Hi, I'm happy you're here. My name is Dr. Hamide Farshi. For over 20 years, I've been passionate about my work as a dentist in Hamburg, and I'm also a book author and one of the top specialists in Europe for the treatment of temporomandibular joint diseases, called craniomandibular dysfunction, or CMD for short. When we talk about CMD, we are talking about a dysfunction of the chewing and jaw system, or a malposition of the jaw joints. It can cause numerous symptoms throughout the body, including a variety of symptoms that you would never assume were caused by the jaw joints. And that's exactly what we want to talk about in this video. And of course, we want to see how you can find out if you are also affected by a malposition in the jaw area. Therefore, what kind of discomfort does malposition of the jaw joints cause? As a CMD specialist, I can point out 4 main symptoms that my patients always have to deal with in one form or another: pain, dysfunction, discomfort, and ear and jaw noises. At least one of these symptoms always occurs, although those affected are unable to name a trigger. They have very specific complaints such as pain in the shoulder or back, but are completely in the dark as to what might be causing them. And so most patients often move from doc to doc over the course of weeks or months, going from one practice to another and always experiencing the same result. There is no explanation for their problems, and then in many cases the result is, "Hello, painkillers." And even I understand it. That is the easiest way to deal with it. And to put it nicely, patients who aren't in pain are satisfied patients for the time being. But honestly, my philosophy as a doctor is different. I don't want to just prescribe any old tablets. I want to find the real cause and correct solution to a problem. However, for this to work, you have to look at people holistically, so to speak, from head to toe, and, of course, first find out whether CMD is actually at the root of the problem. Therefore, how do you recognize CMD? I have listed 6 steps that could indicate whether you are suffering from a malposition in the jaw area. First, check your bite. Check whether your teeth are well aligned. Teeth chattering is a good indicator of this. Yes, that's right, just chatter your teeth. Not so much that it hurts, but enough that you can hear your teeth. Pay close attention to where they are in contact. A very simple rule is, if they also make contact at the front, meaning on the incisors, when your teeth are chattering, then your bite is definitely not right. If this is the case, please make an appointment with a dentist who is knowledgeable in the treatment of CMD. Second, check your condition after dental treatment. CMD often occurs after dental treatment when inserted inlays, fillings, crowns, or bridges do not fit exactly. At the dentist, even a few tenths of a millimeter make the difference between happiness and misery, health and illness, and of course determine pain. That's why I always say, in the first 2 weeks after treatment, you will see whether everything went well or if your bite gets stuck somewhere. If you suddenly suffer from more headaches after a visit to the dentist or notice neck or shoulder pain that did not occur previously, then your bite is probably no longer aligned. Therefore, go to the dentist and have it fixed. And no, you will not offend your doctor or dentist if you make a follow-up appointment because you do not feel comfortable. It happens. It's no big deal. Third, take a look in the mirror. Yes, a good look in bright light. After 30 seconds or a minute, you can ask yourself the following questions. Do you feel that the left and right sides of your face look somewhat the same? For example, in terms of height? Or do you notice an imbalance to some degree? For example, in your eyes or mouth? And does the jaw muscle of the lower jaw perhaps appear a little more pronounced on one side than the other? Maybe this muscle even gets thicker and more visible when you clench your teeth tightly. Clear asymmetry, that is clear inequality, can definitely indicate CMD. Fourth, let's continue with your ears. Now press both little fingers into your ears. Yes, really. And open and close your mouth. If your jaw joints can now be moved easily, great. However, if you see irregularities, if it cracks or hurts, this could indicate a malfunction of the jaw. Fifth, Test your masseter muscle. It is located between the earlobe and the end of the lower jaw. Almost all those affected by CMD react to this trigger point, but especially those who clench their teeth at night or during the day. The masseter muscle is then often visible externally. Therefore, press firmly on this spot on the right and left. If something is wrong, you will feel a pressure pain, which can also be intensified by an up and down movement of the mouth. And with that, we come to the last test for today, the mouth opening. Sit or stand in front of the mirror and open your mouth slightly. Not as far as if you were yawning, but just a little demonstrates, as if you were watching an exciting film. Now look at your face again. Does it currently look straight or is more strongly aligned to one of the two sides? And if it is oriented in one of the two directions, is that the same side of your body where you are currently experiencing symptoms, such as shoulder pain? If so, this could also be a clear indication of CMD. In my new book, The Jaw Code, you will find many more self-tests that may show whether you suffer from CMD. Of course, these tests are all just for information purposes. Although often quite clear, the final diagnosis should be made by a CMD expert. As a CMD specialist, I would of course be happy for you to contact me directly with your problems and questions. If you want, we can track down every puzzling symptom together and I will personally support you on your path to recovery.